What is the scenario? Actually, I didn't get time, Dr. Tamanna. She did give scenario.
Okay. An 8-year-old girl has had 3 ephemeral seizures. You decided to start on treatment. Talk to her parents about starting anti-epileptic medications. Okay.
Okay, right.
So
I'm the role player.
yeah, you're the role player.
Okay,
So it's
okay. Then
page
it's
number
easy.
128, scenario number 20. If you want to just open
Done.
or just for the reference, we'll pause first.
Okay. So you want to start or you want some time?
Doctor.
No, yes, the candidate, so we can start.
Okay.
Okay,
So child name is Asia and you are talking to
right.
Alia, her mother.
Mother's name.
Okay,
Alia. Child's name is Asia.
Okay.
okay.
Okay. Good morning.
Yeah, morning, doctor.
Uh, I am here, Dr. J1 of Pediatric Register. So I believe I am speaking to mother of Alia.
Yes, doctor.
Okay, nice to meet you.
Yeah, same here, doctor.
Okay, thank you. So today we are here to discuss about this condition of Asia. So can you tell me, and before that we start, anyone else to join our discussion?
No, doctor, because the father is at work, so I'm only available. You can talk to me openly, doctor.
Okay. So what you have been told so far regarding this condition or management of the Asia? What is your
Uh, well, well,
yeah.
doctor, as you know, Asia, she had these jerky movements 3 times over the past couple of days, and I brought her here, and they put some wires on her head and did some uh, test for her, and they told me that we'll let you know about the result. And now
Mhm.
they are saying that she has some sort of problem in her brain. So I'm really worried, doctor. Please let me know, doctor.
Okay, I understand your worry. Indeed, it is really a difficult situation. But just before that, I will first explain you what is epilepsy. This what condition? It is called the epilepsy. Have you heard before that?
Doctor, I have just heard, I just heard this in news, but it's something very scary to me, doctor. Is it something dangerous for my life, for the life of my daughter?
Oh, yes, that is your again a valid concern. Let me explain. Epilepsy again, it is the brain disorder which results from the abnormal electrical discharge, and then it is manifested by this abnormal movement as experienced by the Asia's case. So, did you get my point?
Okay, doctor. Yes, yes.
So, for that, she will require the certain medicine or the what we plan to start the medicine to stop this abnormal movements.
Doctor, you are saying that she has some problem in her brain.
Yes, as the condition that is called this, as I mentioned, it is this due to this electrical activity, that is the epilepsy. So to stop and to prevent this further attacks of this activity, so we will start with this medicine to control this situation.
Okay, doctor, but how are you sure that she'll be fine with these medicines?
Yes, over the time we will start with this medicine, and then we will monitor and with the passage of the time, so hopefully she will recover. However, there are certain conditions which may require long life medicine. Did you get my point?
Yeah, doctor, I got it, but it's really scary, doctor. How for how many days she'll take these medicines?
Yes, this depends upon this. There are certain types. So according to which we will start the treatment, and duration also depends on that. And also the medicine also according it will be decided. So it will take time.
Right. So, what do you think, doctor? What is the type of ASIA? Is it a dangerous one, or is it a normal one? I'm very much concerned, doctor. Please tell me truth.
Yes, I understand your concern. So it will be well controlled if this controlled if it is taken regularly. If it, Asia takes the medicine regularly, then complication would have been averted, and we will watch the situation.
Okay, doctor. But doctor, tell me, what can be the cause of this condition? Because I have two more children. I'm worried for them as well.
To be honest, it is there's no known cause. It is an unknown cause. This activity it results due to this unknown cause. In certain condition, it may be if there is any family history, any family predisposition, then the other kids may have. But there is no any this proven cause. Am I clear so far?
Yes, doctor. Yes. So you are saying that when Asia take these medicines, she'll be fine with these. But doctor, one of my neighbor, her daughter is having some problem, and she's taking medicine for her heart. But every second or third day, she's having reaction of these drugs. So I'm very worried for Asia. She might have a side effect of these drugs.
That you are very much right. When Asia's case are these medicines for the epilepsy also have certain side effects. As you rightly told, every medicine has side effect, but we will watch if any side effect, then we will decrease this dose. And accordingly, and if it is the side effects they are unacceptable, then we will switch over to another drug. Am I clear so far?
Yes, doctor. Doctor, I have one more concern. Asia, she is a grown-up girl and she has a boyfriend. How it will affect their relationship?
That is again a very interesting question, because there are certain this contraceptive medicines. Once it involved in this any sexual activity, then it really it affects this the sensitivity of this drug. So they may interact with this medicine, and so their likely chances of the fits they may increase. You got my point?
Yeah, thank you, doctor. Doctor, I have one more question. I'm sorry, I'm asking too much questions, but Asia, she is a late night party sort of character. So, what will there be needing some adjustment in her lifestyle, or is it okay with her?
Yes, that is again a very important question.
7 minutes done.
Yes, in addition to this medicine, the sleep hygiene, that is very adequate sleep is very important. So that needs to be observed very strictly. So sometimes lack of sleep that may also affect, and that may also aggravate this condition.
Time finished? What they said?
1.5 minutes.
Time finished?
Still 1.5 minutes.
Okay, doctor. Thank you, doctor.
You can start winding up.
Okay. So any other concern, if you don't mind, so can I summarize?
Yes, doctor, you can summarize, but I tell you, I have a lot of things coming into my mind, and I'm really worried. And I need to talk to you or anybody senior time and again, because it's a really worrisome condition for me.
Okay, I will arrange another one session with the nerve doctor. Will address your further concern. And today, whatever I have discussed with you regarding the condition of this ASIA, that is called this epilepsy, and for that we will start with this uh, medicine that is called the anti-epileptic drug, and also complications, and also the duration, how long the treatment, and how will it affects this condition. And also I will provide certain website and trusted material, and you can have access and you can go through it. And
Yeah, okay. Okay, thank you, doctor.
the child has
Yeah,
a
all the
thing.
Finished,
all,
finished time.
all the
It is
time is finished, but I have one question left, so I'll also put forward that. Doctor, my daughter, I have 2 days back, I came to know that her pregnancy test is positive. So, will these drugs affect her?
Yes, there are certain medicine we need to know which drug, because there are some medicine that may have effect on this baby. So they will certainly affect. There are certain drug which affect, like this sodium valproate, that we need to know which drug we are going to start. Then we have to second line we will start that medicine.
Okay,
That's it.
doctor.
Okay. Thank you for your
Okay,
time.
thank you, thank you.
Yes, Dr. Tai. Hiring.
Yeah, I think it was not that bad for me. Actually, I was not prepared that much. I just you told me the page, and I just gave a read to this, but I couldn't get too much points. I don't know. It was a haphazard sort of questions, but you did really well. I think you covered everything except the definition of epilepsy. I think you said some signals or something. It was a difficult sort of definition. I think
Abnormal activity.
the
This
yeah
abnormal
electric
discharge.
yeah
Yes.
electrical activity. I don't know. This is a good term. This is a jargon or not. I don't know. Any colleague can comment on this.
Mhm.
But we can say like this that there is abnormal activity in the brain. You can say
Mm.
like
Actually,
this simply.
what I feel like definition was not necessary as such, but like we can
Mhm.
Yes,
say the child had three fits in last few months, and this is because of some abnormal electric activity in the brain, and we need to suppress
yes.
that electric activity by starting
Hmm.
some medications. It would be simple.
Yes, they need to be simple. Yeah, very good. Rest of the thing, I think it is a very good one. Uh, Regarding this question of the last question, what drug you will give, I think we should say like this that yeah, that's really kind of you that you told us that she's pregnant currently. So definitely we will prescribe a drug which will not affect her baby.
Mm.
I think that sounds a bit mm, more in line with this. And when I ask about this late night parties, I think at this time you should also tell me about the things which can trigger epilepsy. Like you should say that not only lack of sleep, other things like alcohol, few drugs, anxiety, excitement, blah blah blah. These all can or fluctuating lights or zigzag sort of lights or sudden flashes of light. All these things can aggravate or can result in a seizure. And there
Alcohol,
was
right.
yeah,
Mm.
there was one other question even with me that doctor, for how long I'll take this medication.
Mm.
I asked you that for how many days. Then you said we will regularly follow up. But yeah, this is a good question. This is a good answer. But you can answer also in this way that if there is no seizure activity for 2 or more than 2 years, I don't know. I think 2 years, so we can taper the drugs, and if there is no seizure during tapering of the drug, then we can even stop the drug. And I had one more question regarding the driving, that she usually drive by her car to the school. So how you look into that? What about
Mm.
her driving license and all this? So it's a very open sort of thing, but you did really well. It was very good from my side.
As well as
Other-
swimming is also important. Supervised swimming and helmet, bracelet. These are the
Yes, yes,
uniform, the written plan.
yes.
Epilepsy
Yeah.
team, school involvement, so teacher and nurse, epilepsy nurse, like.
Yeah, but by the way, I just forgot. What about this driving license? They will give driving license to someone epileptic or not?
No, again, if they are, it is written if it is symptom free, it is like the driving license also for day for night. The criteria is different. I think for it is more than 2 years. It is the symptom free. There is no any seizures, no breakthrough. Then they can apply for the daytime. And if more than 3 years, I think more duration. Then also in the night time like that. It is written somewhere.
But I think anyway, in UK they do not allow to drive a car. I think before 17 years or something like that.
8 years, I think.
18.
18, yeah. So I think we can say the bicycle or like that.
Dr. Sandeep, your insight.
Yeah, it was good. Oral information was good. Initially,
Mhm,
definition was a little bit complicated, as Dr. Tahir said.
mhm,
Could have been little more sympathetic. Like I understand your concerns and all, little bit, but overall
mhm.
good.
Okay.
Hello.
Yes.
So
Yeah. Regarding the duration for hello.
yes, Dr. Maila, you can.
Yeah. Sorry. Regarding the duration of the treatment, you can say it's okay. The best one who's advised you regarding that was the nerve doctor, okay? Because you aren't the one who decides the treatment duration. But I can reassure you, if the nerve doctor found that she's doing well with the medication and she's free of these fits, he can stop it, okay? But the best one who's advise you regarding the exact duration who's the nerve doctor, because you are a pediatrician, general pediatrician, so you aren't the one who will prescribe this medication for her. But regarding the general advice regarding swimming, showering, and driving license and her future, you can give advice regarding that. But for the medication, you cannot just tell her the exact time because you aren't the one who prescribed that.
Okay, okay. So
Yeah, I think it's a very valid point raised, but we just because you need to be a multi-directional while you are doing communication.
right.
So let's suppose the doctor is a nerve doctor, and I'm talking to a nerve doctor. Let's suppose the candidate is a nerve doctor. So that's why we wanted to cover every point.
Mm-hmm.
Yeah,
No,
I know. But you are a pediatric registrar, not a nerve doctor.
she
You are a pediatric
also right.
registrar.
She
Yeah,
you
yeah, she's right. She's right. Yeah,
usually if she you will say like this, if usually if the patient or the she is seizure free for 2 years, nerve doctor usually stop the medicine. Try to plan to stop, but they totally
excellent.
yeah. So cover
Yeah,
both sides.
excellent. Yeah.
And everything was good. I want to give one very small thing. When he said, Dr. Tai said that my this Aisha, whatever name, she has boyfriend and blah blah. So that time JP sir said it is very interesting question. So that was really funny.
Boss, you are really boss. You want to
During
speak things.
what we do, we don't know.
Uh,